I'm Terry Jerolome. I live in Burlington, Vermont. I've lived here for the last 6 years. But during the early 1990s, I was an immigrant to Canada, and I had the healthcare insurance card in both Montreal and Toronto, and I was able to choose any doctor that I wanted, and there was never any charge. I also, when the doctors prescribed blood tests, they were free of charge. And when I needed medicine, there was no charge for the medicine either. But after 2.5 years, I never had to wait when I was for any of the services when I was in Canada. But after 2.5 years, I moved back here for career reasons, and I lived in Albany, New York, where I had to pay an enormous amount, $120 for an office visit, $350 for blood tests, and about $600 a year for my medicine. So after the first year, I started going back to driving 350 miles back to Canada for my annual checkups, and the checkups were about $40 for the office visit, where the doctor spent more than half an hour with me, and blood tests were another $40, and the medicine was half the cost of what I paid here. I believe healthcare is a human right. All other developed countries provide all of their citizens healthcare, and we need a system like the Canadian system where everyone can be assured of healthcare. The distribution of wealth in America, 1% of the population has 90% of the wealth, and they have all the choices. The rest of us don't have the choices, and that's not fair.